Our global health ministers are gathered in Geneva for the annual World Health Organization meeting amid concerns over the Ebola and Hantavirus outbreaks. The summit runs through Saturday and focuses on setting global health policy. In its latest global pandemic preparedness report, the WHO warning that the world is not ready for another pandemic, despite having more knowledge, tools and resources. On Sunday, the UN health body declared an Ebola outbreak in the Democratic Republic of Congo and neighboring Uganda an international emergency. The WHO warned the rising number of cases could signal a far larger outbreak, but says it's not a pandemic emergency like COVID-19. William Denselow is covering the story for CNA from Rotterdam in the Netherlands. The WHO warning that we are not ready for another pandemic, despite having the wherewithal to be ready. What else stuck out from the latest report?
Well, that's really a huge concern, considering the fact that it's roughly 10 years since the Ebola outbreak in West Africa, 6 years since the COVID-19 global pandemic. The message from the WHO is that these incidents highlighted gaps in the public health system and that these gaps still remain. In fact, they say that the world, despite increased investment, that investment is not keeping up with the risks the world faces and that these gaps do remain. They say that there are certainly efforts and there's certainly the ability to help combat some of these threats, but not enough is being done. A huge focus, the WHO says, needs to be on addressing inequality. The fact is that there might be a vaccine produced, but there's not enough global equitable procurement of the vaccines. There's a distrust when it comes to the science behind them as well. These, the WHO say, are all episodes that need to be addressed. They point to the recent outbreak of Ebola in places like the Democratic Republic of Congo. They say that is evidence for why a shared global response to these kinds of crises are urgently needed.
All right, Will, we can see right where you are in Rotterdam, the Hantavirus-stricken cruise ship docking in Rotterdam and the ship due to be disinfected, the 27 on board to be disembarked. What's it like where you are?
Absolutely right. Well, we are just a little bit down the coast from where the Hondius has docked. We were taken on a press boat trip to go alongside the Hondius as it was arriving into a port. We could see people wearing masks on the decks of the boat as they're waiting to land. Of course, this is a journey that began for those crew members some 7 weeks ago in southern Argentina, and what a harrowing journey it has been since then. Now, the location, well, it's a little bit away from the port of Rotterdam. Let's not forget, this is Europe's busiest port. So they chose a location that's slightly out of where the main flow of trade, flow of people typically is, but still accessible for medical units to be able to get to these people. We understand that the crew will be sent to mobile homes that have been set up just on the dock. So as soon as they step off the ship, they'll go into these temporary accommodation where they'll be for the rest of their quarantine period. The message we're hearing from public health experts we've been speaking to a little earlier, they say they are confident that during this 6-week incubation period or so, that there is very little, minimal risk to the wider public.
Thanks. William Denselow there covering this story for CNA from Rotterdam.